Okay, great. I think we've got 7 o'clock here in the UK, so we'll start. Thank you very much for everybody that's joining us live this evening, and for everyone that's watching back as well, asynchronously at your own time. So thank you for joining us. Um, really pleased to introduce Pilar tonight. And we're going to be talking about forelimb lameness and how to localize the source of lameness. But before we get on to that, I'd just like to introduce myself and a little bit about why we're here doing these webinar series. So Pilar, if you can just move the slide on, that'd be great. So we've got lots of series of webinars. We were just talking about this a second ago. We've probably got over 20, probably up to 25 now that we've done over the last year, which are really showcasing our specialist case advice team. And we want to talk a little bit about that today. So you're very familiar with VET.CT, I'm sure, because you've enrolled. But just as a sort of recap, we are a global team of over 200 specialists. And essentially, when you boil it down to it, we're just here to help you. In whatever clinical situation you're in, we're here to help. VET.CT itself specializes in really exceptional radiology, advanced imaging, CTs, MRIs. We also have a specialist advice service, which is what we're talking about today. So this is our area, and we have probably 11 different disciplines, around 50 different specialists in the team working with you collaboratively. I'll go into that in a second. And we also have education services where we train and teach the upcoming radiologists and others around the world in different institutions. So the written specialist case advice, like we said, we're going to be talking about that team today. Essentially, what we do is we give you written advice to treat cases in-house, and often to choose that secondary pathway as well if you're considering moving that case on to another colleague or a specialty centre, and we can help in that as well. We really pride ourselves on really fast turnaround times. So the written advice will come to you in up to 24 hours, often sooner. We also have live availability in orthopaedics, internal medicine, neurology and oncology around sort of 12 till 4 or 1 till 5 European time to cater for our European colleagues. And what we pride ourselves on really is that this isn't just a one-stop shop. It's not just a sort of one transaction and then move on. Managing cases, as we know, is a process, and it's a conversation, and they evolve. So we offer that continual conversation through our platform where you can actually ask more questions, and we can start to help you with that case as it progresses as well. We provide those detailed notes to your file in the form of a PDF. And actually what we find is, and we have it on the platform as well, so you can use those notes how you like. And actually we find that teams share that into sort of team messaging groups like WhatsApp or text message groups that they have in teams when they're handing over patients. So our notes augment that sort of complementary style that lots of teams work in. What we do know is that clients, so vet clients, pet owners, are absolutely delighted to stay with the vet that they know and trust, which is generally everyone out in primary practice or in specialty practice. So they're delighted to stay with that, but they're also delighted to have this sort of multidisciplinary team on their shoulders. And that's how I'd like to think about what we do, is we're there to back you up. So we're just part of your practice team or your specialty team. And what we do is we give those clear and detailed next steps to really help to reduce uncertainty. So a lot of our clients say they sort of know what's going on, but they just want to reduce the uncertainty. And so with that sort of confidence boost as well. But really, really easy to use. So if you go to a desktop site, so click on the QR code and we've got some details there. Or we've got an app on your phones or the tablets if you use them within practice. And actually with those, especially with orthopaedics, we'll see we've got some videos today. You can take multimedia with those, obviously, and you can upload them really quickly, and you can submit things through the app as well. And to use us financially, you don't necessarily need a subscription. Lots of our clients have subscription because it proves incredibly great value. But we also can just help with cases. So we do a pay per case and we do a subscription as well. And if you want any more details on that, then please do let us know. Pilar, next slide if you can. So if anybody wants to know about our services, please feel free to reach out to our sales team or myself, Richard Artinshaw. I'm Director of Teleconsulting, and we'll be delighted to help you in that journey. So Pilar, next one if you can. Okay, just a bit of housekeeping today. So this will be recorded. So anybody who's enrolled on this will get a recording afterwards. So don't worry about that, and that should come through pretty quickly. We will be taking questions later, but because microphones are turned off, just for ease of use of Zoom, if you can pop them in the QA box at the bottom of the screen, and at the end, myself and I'll ask Pilar the questions, so you can sort of populate those as well. That would be great. Okay, right, that's enough from me. So great. Really delighted to have Pilar back again. So Pilar's already done a localizing lameness, but actually what we're going to talk about today is the sort of dark. I'm orthopedic surgeon by trade as well, and this is like the dark arts of lameness, I think. And I think so many people, including myself, have a challenge with forelimb lameness, actually understanding where it is, because everything's interlinked, everything moves together. So it's going to be really good to get some tips and tricks from Pilar to think about things logically and how to localize the source of lameness. So Pilar, really looking forward to this. Thank you very much for being here. Pilar's part of our orthopedic team, and I'll hand it over to you, Pilar.
Thank you very much, Richard. Thank you very much, everyone, for being here tonight. So as Richard was saying, today, this is kind of like a continuation of the previous webinar, which we are starting from the beginning, trying to diagnose what the problem is in our patients. So today, we are going to be focusing on the forelimb, on an animal with a forelimb lameness, and how to localize where the source of the lameness is. So here we can see a typical dog with lameness. In the last webinar, we learned how to evaluate lameness. It's very well. It's quite easy to see that this dog is lame on the left fore because there is a clear head bob. And I will do a little bit of a refreshment of what we talked about in the last webinar. But obviously, now that we know that the dog is lame on the left forelimb, we need to try to see where the lameness is coming from. Is it the elbow? Is it the bone? Is the shoulder? Is a soft tissue problem? So that's where the orthopedic examination plays a critical function, actually. Is a critical part of the diagnostic process in orthopedics. So we will go step by step of how to perform an orthopedic examination. As I said, I'm just going to quickly refresh what we saw about gait evaluation. I will mention a little bit about general physical examination, which is also very important, as we need to have as much information as we can to try to reach a diagnosis in our patient. But then we will focus on the orthopedic examination. And I'm sure that my colleagues in neurology have done other webinars about neurological evaluation, but many times our cases are, going maybe coming to orthopedics and they are actually a neurological patient, or maybe they have a patient that go through the neurology service, but actually they are orthopedic, because sometimes the lameness is very similar. And then that's when doing this orthopedic examination and the neurological evaluation is going to help us decide if this is an orthopedic patient or is a neurological patient. And we worked very closely, actually, the two services. So previously, we mentioned that we need to follow some steps so that we can reach the last step, which is step 9, reach a diagnosis. So it's very important to get a very detailed history from the client. The signalment of the patient is going to give us some clues if it's a young animal or an older animal, the species, etc. That's going to give us clues about what the possible diagnosis could be. In the previous webinar, we talked about gait evaluation and the different techniques that we have. The most commonly used is the visual evaluation, which is a subjective technique, but we also have objective techniques. Very important always to perform a general physical examination. The animal may suffer from other conditions that actually could be related to an orthopedic or a musculoskeletal condition. So it's very important that we detect those changes, or just because that animal is going to be placed under sedation or anesthesia, we need to make sure that that animal is healthy, or that is safe to go ahead and do the sedation and anesthesia to do diagnostic imaging, for example. The next step will be very, very important. And those of you who have sent cases to orthopedics, we always ask you, what did you find in your orthopedic examination? What was the severity of the lameness? Because it's very important, and is giving us clues to decide what the differential diagnosis could be. We many times include some neurological evaluation, maybe not as complete as the neurologist will do, but at least a basic neurological examination, just to decide if it could be neurological or not. And then we discuss the case with the neurologist. And then with all this information, hopefully we can establish a differential diagnosis and then decide which diagnostics are most appropriate to reach a diagnosis. So it's very, very important to do the orthopedic examination so that we can hopefully localize where the problem is, so that we can decide where to focus our diagnostic imaging, for example. And then hopefully we will reach a diagnosis. It's not always the case. Sometimes we have these challenging cases. Actually, sometimes you send us some weird and challenging cases that actually are a learning process, a learning experience for us as well, because we may have never seen a case like that before. So it's very good. You are sending very interesting cases to us. So in the last webinar, we mentioned about gait evaluation, which is very important as well to know where the animal is lame, and also the characteristics of the lameness, the severity, etc., etc. The most common technique that we use is the visual observation, but as I mentioned before, and I'm not gonna explain them again, we have more objective techniques like measurement of forces or pressure, so kinetics, or the measurement of movement of the limbs. So we mentioned about the visual observation, where we observe the animal at walk and at trot in a straight line coming towards us or away from us, so that we can evaluate the joint movement, the movement of the different parts of the body, the step length, how much weight they are bearing on that leg, if there is any head bob. And in some cases that can be a little bit more challenging, or the lameness is more subtle, we will include also the animal walking in circles. That will make it a little bit more clear. It may help in those cases where the lameness is a little bit more subtle. So for example, in this case, we can see a dog that is lame on the left fore again, is lifting the head when the lame leg is on the floor. So in this case, is lifting the head when the left fore is touching the floor. So that's a very clear head bob. So this is what happens in the forelimbs when the affected limb touches the floor and bear weights. It's painful for them, so they lift the head. So they are trying to shift the weight towards the hind limbs. While when the sound limb is on the floor, then they lower the head, so that the shifting of the weight is towards the forelimb. This is the opposite when it's the hind leg, but we saw that last week. So this is the same dog. We could see that it's still lame on the left forelimb with a clear head bob. In some cases, we may see differences between pavement and grass, especially when they have problems in the toes, in which cases the lameness might be much more evident on a hard surface than on a soft surface. So that could be also help to think that maybe the problem is in the foot, for example, or in the feet. There are some gaits that are very characteristic, like this one we saw last week. So this is a dog with gracilis contracture, and just by looking at the dog, we can see that abnormal movement of the tarsus, which is pathognomonic for gracilis contracture. Sometimes you may need to use slow motion videos. So just a refresher of what we saw last week. But it's very, very important to know where the dog or the cat is lame. Another characteristic lameness is this one with external rotation of the forelimb. This is a dog with infraspinatus contracture, and is pathognomonic. So obviously we can see the lameness. In this case, is pretty much we have the diagnosis already. But in the general population, we can only localize where the lameness is, in which limb or limbs the lameness is. But now we need to try to figure out where the problem in that limb is. So after walking the animal outside of the room, then I do the rest of the examinations that require some manipulation of the patient. I always do, and I would recommend you to do a general physical examination. Well, you know how to do that. Check the mucous membranes, the eyes, the oral mucous membrane, do the CRT, check the lymph nodes, do a thoracic auscultation, see if there's any heart murmurs, how's the rhythm and the speed of the heart, also how the lungs sound. And abdominal palpation as well, very important, temperature as well. So this is very important because it can flag some systemic problems that can be completely independent from the orthopedic condition or the orthopedic problem, but they may be related as well. So imagine an animal with, for example, a heart murmur and not necessarily fever, but maybe that dog has endocarditis, and that could lead to having an immune-mediated polyarthritis. So that's why it's important to do the physical examination, because some systemic changes could be related to the orthopedic condition. We also need to know if the animal has received any previous test or any previous medication or treatments, and how the animal is generally is. And then we follow with the orthopedic examination. And this is critical because we know, or hopefully we know, where the animal is lame. Sometimes lameness is a little bit more subtle, or when it's affecting several limbs, it might be a little bit more difficult to see. We talked about that in the previous webinar. But generally, we can localize where the lameness is. Is the left forelimb, or both forelimbs, or both hind limbs? But now we need to know where the problem is in that limb. And that's why the orthopedic examination is critical. So during the orthopedic examination, we are going to be manipulating and palpating different parts of the limbs, all four limbs. So very important that we pay attention not only to the areas that are painful, which is very important, and that's why we always need to try to do an orthopedic examination with the animal awake, if possible, to try to see where the animal is painful. That's very important. But in some cases, the animal may not be manageable, or it may be quite challenging to do the orthopedic examination with them awake. So we may need to do the examination with them under sedation. We lose some information from, where an area that is painful or they have discomfort. But we have a lot of information that can actually pinpoint at where the problem might be. Okay, so we need to check muscle volume, muscle and tendon tone, if there is any laxity of the tendons, if there is muscle atrophy, that can help us as well. If there is any area that has increased temperature, generally joints, which could be related to some type of arthritis, pain. This may be variable, and sometimes we cannot check it because we need to do the orthopedic examination under sedation, or the animal is very stoic and doesn't actually talk that much and doesn't reflect an area that is painful. But we can check, is an area that is swollen, and that's why, and you will see when we do the orthopedic examination, we start with a part where we do it with the animal standing, so we can palpate both forelimbs and both hind limbs at the same time, so we can compare one side to the other. And sometimes the changes can be quite subtle, but if you palpate both limbs at the same time, you can feel if there is any swelling, an area is more swollen than the contralateral limb or the muscle atrophy, as I was saying before. Same for joint effusion. It's not the same as swelling. Generally, swelling involves like the soft tissues also around a bone or a joint. Joint effusion just involves increase in the amount of joint fluid, which is not generally related to swelling in the rest of the joint, for example. Also, very important, do we feel any type of crepitus in that joint, for example, or in a bone that could be related to a fracture? Very important, the range of motion of that joint. If it's decreased, that it will mean that there is a problem in that joint. It could also be increased if there's some instability in the joint. So very important that we check all those things, not only the area that the animal is painful. And sometimes we will see changes in several joints, like joint effusion or crepitus in several joints, and obviously the pain is going to be critical to know which one is playing a most important role in the lameness that the animal has. But sometimes it's not very easy for an animal to reflect that or to show that pain. It's not that common that an animal howls in pain, so we need to pay attention to even subtle changes in breathing. Sometimes an animal is panting. It's quite common when you are doing your orthopedic examination and they are panting, and then suddenly you are manipulating an area that is painful and they stop panting for a sec, and then they continue when you go on with another joint. So that's not really, I don't know if we can say that they are showing pain, but that could be a subtle sign that something is bothering them. Or sometimes they may change the opening of the pupils in an area that is a little bit more painful for them, or they start licking the lips. So those subtle changes could mean that an area is uncomfortable to them. So pay attention to even slight changes in their behavior. So hopefully by checking all these, we will be able to localize an area that is the source of the lameness that we saw during the gait evaluation. So to perform an orthopedic examination, it needs to be systematic and ordered so that we don't forget to check anything in the limb, okay? And I always recommend to evaluate all 4 limbs. Even if an animal is lame, very obviously in the left forelimb, for example, it's very important that you do the orthopedic examination on all 4 limbs so that we have the whole picture of how the dog is doing, because the animal may have another problem that may change how we will approach that patient or how we will manage that patient. So very important to evaluate all 4 limbs. Generally, we start with the first part of the orthopedic examination is with the animal standing. And then we will follow with the orthopedic examination. I generally do it with the animal in lateral recumbency. I find it easier. Some animals get very, very stressed when they are in lateral recumbency. So in those cases, I will also do it with the animal standing. But I think I can do a better job if they are laying down. And I generally leave definitely the limb that they are lame. I leave it for the end because probably there will be an area that is painful, so I don't want to stress them too much from the beginning and make them, very jumpy. So I generally do the area that I think is painful to last, so that they are a little bit relaxed. So we need to try to have the animal relax, maybe with the client, maybe we can do some patting. And then, as I was saying before, when we do our orthopedic examination, check not only for signs of obvious pain, but also changes in respiration, or if they get a little bit more agitated, that can give us clues. In some cases, some animals might be aggressive, or they are very weakly and puppies, and you cannot do a proper orthopedic examination, and we may need to do it under sedation. In those cases, we miss the information coming from where the animal is showing pain, but we have other signs that could help us localize where the problem is. So as I was saying, this orthopedic examination needs to be systematic and ordered. We will check the soft tissues, the muscle volume, tone, temperature, also the joints, range of motion. You can even use a goniometer so that you can track down how the range of motion is going, after treatment. If we feel any crepitation, stability or instability of that joint, if there is joint effusion, temperature, very, very important. Also the bones, any changes in the bones, especially pain or any crepitus, which could be a sign of fracture instability. And also when the animal is standing, and we will see, we need to see the limb alignment and the position of the different joints. So with the animal standing, we can check, the position of the limb, if there is any joint that is in an abnormal position. For example, we may be able to see if there's hyperextension of the carpi, or for example, if there is an abnormal position like we see here in this dog, there's an abnormal position of this digit, which is a sign of digital flexor injury. This is a flat toe. So it's an injury to the superficial digital flexor tendon. And we generally do an examination, as I said, with the animal standing from the caudal aspect of the animal, and we palpate both forelimbs and hind limbs to see if there is any differences in muscle mass, in joint effusion, in temperature, etc. So I have a few videos in this presentation. So this is a dog. This is how I would do it. Just make sure that the animal is standing square so that everything is more symmetric. So I'm palpating muscle mass, if there's any difference in joint fluid volume in the elbows. I'm checking, swelling and temperature along the forelimbs, especially, increased temperatures in the carpi, for example, or increased joint fluid, joint effusion. I usually take advantage of having the animal standing to check the CPs, but we can do the neurological examination at the end. So I find it easier to evaluate for joint effusion when the animal is standing rather than when they are laying down, because when they are standing, obviously there's weight bearing through the joint. So I think it's easier to feel if there is joint effusion. And also you can check the volume much better when you can compare one side to the other. So in the next webinar, I will talk about the orthopedic examination in the hind limbs, but we do it just next or after the forelimb evaluation. Again, checking muscle volume, temperature, if there is any joint effusion, any differences from one leg to the other. We will see about medial buttress, etc. And then I check the CPs. Also, it's a very good position to check for integrity or tension of tendons, for example, the common calcaneal tendon or the triceps tendon. As I said, it's easier to feel joint effusion when the animals, or at least for me, it's easier to check for joint effusion when they are standing. So in the forelimbs, you can feel for joint effusion lateral to the joint. So between the olecranon and the lateral epicondyle, that's an area that generally is kind of like there is a depression. So if there's joint effusion, there's kind of like a bulge of joint fluid. In the carpus, the easiest area to palpate joint effusions is in the craniomedial aspect. So generally, there's also a bulging of fluid in that area. And then when we talk about the hind limb, we will talk about the stifle and the tarsus. So check the temperature, weight bearing. So this is a quick orthopedic examination with the animal standing. So it doesn't take too long. We start with the forelimb, checking joint effusion. I'm checking the stifles in there, medial buttress, joint effusion in the tarsi. So it can be pretty quickly, but doing both sides at the same time can help you decide, it feels a little bit diffused in that side in comparison to the other side. We'll see in the hind limbs, but not many people, and I would recommend you to always check the iliopsoas for hind limb lameness, although this is not the topic today, but they are generally quite painful when you palpate the iliopsoas just under the lumbar vertebrae or just going to the lesser trochanter. They are very, very painful just going into that area, and when you do extension and internal rotation. So this is a dog. It's very, very painful in the iliopsoas, but we will go a little bit more, we will explain a little bit more of this in the next webinar. So then I place the animal in lateral recumbency. You can do it on the floor. You can do it on a table, examination table. In this case, again, you need to do it systematically and in an order way. I prefer to do it from distal to proximal. It's very common to have elbow and hip problems, so I tend to start from distal, where it's not that common to have issues, and then go proximal, but you can do it from proximal to distal as long as you always do it in the same order so you don't miss anything. Okay, so I leave the affected limb to the end, and when you do the orthopedic examination, you need to check every joint. You need to check the range of motion, if there's crepitus, if there is instability, and if there's pain. So you will see, I will show you some videos about orthopedic examination and how I do it. And then obviously we cannot forget the bones. There are some bone conditions that, especially puppies, that can be very painful and causing lameness, like panosteitis, for example. So we need to palpate along the bones, not forgetting the bones. So this is a quick orthopedic examination. We will go joint by joint and area by area. So I start from distal, I manipulate the toes, the carpus, I check range of motion, instability, as you can see. I'm checking the radius and the ulna and the elbow, very common joint to have problems. Check the range of motion, even forcing a little bit in pronation and supination, palpating along the humerus, manipulating the shoulder, but we will do this, we will check this a little bit slower in the next slides. And don't forget about the tendons in the shoulder. We are diagnosing more frequently supraspinatus and biceps tendinopathies. So they're getting more and more common. So in the forelimb, we start with the digits. So let's start the video so I can talk at the same time. So you can check all the digits at the same time. And then if the animal reacts, then you can go one by one, depending on your suspicions, but you can check them one by one. Generally, you can feel the bone really nicely. So you can see if there's any swelling. If the joints feel swollen, you can check in between the toes so that there's no foreign bodies, for example. Like I'm doing there, I'm checking the bones. I'm checking the range of motion. Very common that they have osteoarthritis in the metacarpophalangeal joint, especially the fifth digit in older dogs. So generally that range of motion is going to be decreased. We need to palpate the metacarpal bones, make sure that they are not painful. Also the sesamoid bones, which are in the palmar area here, just proximal to the main pad. So we can see if the animal reacts or if we feel something abnormal, like decreased range of motion or increased size, for example. And then we get to the carpus. I'm checking the flexor carpulnaris as well, but we will see the next slide a little bit more in detail. So we continue with the carpus. In the carpus, as in any joint, you need to check the range of motion. So here, while we are checking, you can check for joint effusion. For me, I find it easier with the animal standing. So check for range of motion. That's the normal range of motion of the carpus. So they need to almost pretty much touch the antebrachium. So with the carpus in extension, and it's very important that it's in extension, you check for mediolateral instability. If you do this, if you check for mediolateral instability with the carpus a little bit in flexion, there's going to be more movement. So it needs to be done with the carpus in extension. We also check if there is any instability craniocaudally. And then I think it was before that I check here, that I check the integrity of the flexor carpulnaris. So range of motion, stability. And then, well, here I'm doing Campbell states, but this is for the elbow. So we will do it later. And then we continue with the radius and the ulna. So again, deep palpation along the radius and the ulna and see if the animal reacts, especially puppies, which may have these bone diseases. And then we get to the elbow, a very common joint that is affected. As always, we need to check the range of motion. You can apply as well pressure in the medial aspect of the elbow. Generally, they can be painful with elbow dysplasia with medial coronoid disease, but we are checking range of motion. As you can see here, this is the normal range of motion. So the carpus almost touches the shoulder. And then when we have full flexion, we will do supination and pronation like this. And especially in animals that don't show a lot of discomfort or they are a bit more stoic, we can elicit actually discomfort with medial coronoid disease by forcing flexion and then supination and pronation. Then to check stability, again, in extension, and then especially in animals with elbow luxation, after close reduction, we need to check the collaterals, and that's done with this is performed by doing the Campbell's test. In the next slide, I will explain a little bit more, but we need to put the elbow in 90-degree flexion and the carpus in 90-degree flexion, and then do supination and pronation to check those collateral ligaments and see if they are damaged, and decide we need to go to surgery even after a close reduction of the elbow. So this is what we do after to check the collaterals. We flex the elbow and the carpus 90 degrees, and then we do pronation and then supination. They have the normal angle of pronation and supination. Generally, the angle of supination is larger than the pronation. So in dogs, it's 70 degrees. In cats, as you can see here, is more. The supination is 110 degrees. This will be the normal angle. And pronation is always less. They can pronate less. In dogs, the normal pronation angle is 45 degrees, while in a cat, you can see that is 70 degrees. So when this pronation is increased, instead of being 40 degrees, is generally almost double, like 90 degrees. Generally, that means that the medial collateral ligament is damaged. If we do supination, which is a little bit usually larger, the angle, but the normal in dogs will be 70 degrees. If we have more, like almost 140 degrees, that means that the lateral collateral ligament is injured. And in cats, we need to have in mind that pronation and supination, that normal angle is larger than in dogs. So when they have injury to those collaterals, it will be much larger than these numbers. So then we continue, we leave the elbow and we continue with the humerus. We do deep palpation along the humerus to see if there is any pain, any inflammation, any crepitus consistent with a fracture. And then we get to the shoulder. So don't forget about the tendons in the shoulder. Here we have the supraspinatus, we have the biceps tendon, we have the medial and the lateral glenohumeral ligaments, which can be injured and cause pain in the shoulder. So we need to check that. So to evaluate and I will show you a video, to evaluate those tendons, this is what we do to evaluate the supraspinatus. So we flex the shoulder, we keep the elbow flexed, and here we are stretching the supraspinatus, which inserts in the greater tubercle of the humerus, and we apply pressure directly on top of the greater tubercle. So generally in animals with supraspinatus tendinopathy, they may be painful or they may show some flickering of the muscle. To check the biceps, we need to flex the shoulder but extend the elbow because the biceps crosses the shoulder and the elbow. The origin of the biceps is the supraglenoid tubercle, and it inserts in the ulna. and the radius distal to the elbow, so we need to stretch it. And to do that, we need to flex the shoulder and extend the elbow. It doesn't look very extended here, but it's extended. And then we apply pressure medial to the greater tubercle. So that's where the bicipital groove is, and that's where the bicep tendon is. So we need to apply pressure in that area. Remember, for the supraspinatus, we apply pressure over the greater tubercle, but for the biceps, we go medial to the greater tubercle and with the elbow extended. So that will be the biceps test. So this is a video, hopefully it runs. So we are palpating the humerus proximally, see if the dog is painful. While we are here, don't forget to check the brachial plexus, especially in older dogs, in case they have any masses in the brachial plexus. So now we are checking flexion extension, so range of motion of the shoulder. And then now we are checking the supraspinatus with the shoulder inflection. And then if we extend the bicep, we check medial to the greater tubercle and we are checking the bicep. Then we extend the shoulder a little bit, and by fixing, let me stop the video, we fix the scapula and then we abduct the rest of the limb. And that way we can have a feel of how much abduction that shoulder has. And we need to feel resistance. We cannot really abduct too much. Okay. Theoretically, we need to measure with a goniometer, but at least during the orthopedic examination, we can have a pretty good feeling of how it feels, if it feels really loose or there is, resistance to abduction. So when we do this abduction test to check if the animal has medial shoulder instability, we need to stabilize the scapula with the limb a little bit in extension. We stabilize the scapula and then we abduct, we elevate the rest of the limb. As I said, we theoretically need to do it with the animal under sedation and measure with a goniometer, but even during the physical examination, the orthopedic examination with the animal awake, we can have a pretty good feeling of how it feels. In a normal dog, we can compare it with the contralateral, but sometimes they can have bilateral issues. So a normal angle will be around 30 degrees. If it's affected with medial shoulder instability, it can be higher than 50 degrees, but not always, because there are different degrees of medial shoulder instability, so they don't always have an increased abduction angle, especially in the less severe conditions. We can also do a little bit over the drawer test to check for stability, craniocaudal stability in the shoulder as well. And then the scapula, we need to palpate along the spine of the scapula to see if there's any area that has pain, that elicit pains, and also check for the mobility of the scapula, especially proximally, in case there is a luxated scapula. So this is the same video as before, just for you to see. I mean, you can do it quite quickly, and you can pay more attention in an area that you feel doesn't feel completely normal. But you can do an orthopedic examination quite quickly. So here I'm doing pronation, supination, checking the humerus, now the shoulder, checking the biceps here. I didn't check the supraspinatus. I should do it. And then the medial shoulder instability. So you can do it quite quickly when you get used to it. So cats are a little bit of a different story. Just I mentioned in the previous webinar about the gait evaluation in cats, which is a little bit more difficult. You can just let them walk around in the room and see how you can evaluate the lameness, but they tend to walk a little bit more clunched. And so generally we only grade it in low grade, medium grade, or high grade of lameness. For orthopedic evaluation, we do it in the same way. The first part with the animal standing and the second part with the animal laying down. But cats can be challenging and they get very reactive when they are held very tightly. So I try to do it without a lot of restriction. But you can see here that I'm doing with the animal standing up, I'm palpating the muscle, and see if there's any differences. So in the same way as a dog, but try not to restrict them too much because they get very annoyed. And then also in the hind limbs. The second phase, with the animal laying down, you can hear, and I don't know if you can hear the cat, but it's complaining already, and they get really tired of being examined. So I try not to restrict them too much. Sometimes I have to do the orthopedic examination with them standing up, but I will do it in the same way. So just be aware that cats have more elastic joints. So that movement, especially in the carpus, the mediolateral movement is going to be more marked than in a dog. But just check it, compare it to the opposite limb. So generally, the joints are a bit more elastic. So just remember that. And also check for possible bite wounds, because it's not uncommon that they have bite wounds and they develop these abscesses and then septic arthritis. So for example, the difference in joint laxity or joint range of motion between a cat and a dog. Here we have, well, this is the Campbell's test. You can see the pronation and supination in comparison to a dog. Okay. Well, in this case, I'm pretty much doing just pronation, but you can see that the pronation in a dog is less marked than in this cat. Supination and pronation in this cat. Also, if we check mediolateral stability, I don't know if you remember when I was doing the ortho exam in the dog, there was not that much movement with the carpus in extension. So just remember that they are going to have a little bit more movement. So it will be a matter of, comparing to the opposite side, to the contralateral side, and, remembering that cats have a more elastic joints. And that will be the orthopedic examination. But as I mentioned before, some animals come to the neurology service because they think it's neurological and they end up being orthopedics. And sometimes they come to the orthopedic service and actually they are neurological. So I always include a basic neurological examination, at least I check the CPs and, for spinal pain. But obviously, if you have an animal like this one that is obviously neurological, it's kind of like a taxi is falling down. So we will do a complete neurological examination. We will add postural reflexes, spinal reflexes, etc. Okay? So very, very important to check. And I talked before about the gait evaluation. So just be aware of those animals with severe lameness, with marked pain, and very progressive muscle atrophy. In those cases, when I see a dog this lame, which is very severely lame, I think of either a fracture. Well, I didn't put it here, but an infection. So if they have a septic arthritis, they can be very, very lame. Or neoplasia, like an osteosarcoma, or even a neurological neoplasia, like this dog here had a nerve sheath tumor. Okay, so when they are this lame, I think about some type of neoplasia. Sorry, I should say here infection, like septic arthritis. So this dog, this dog on the left, you can see that it's very, very lame. Actually, this dog was very, very painful. There's a lot, you can even see that there's a lot of muscle atrophy. This dog had an osteosarcoma. And this cat on the right, this is a very severe lameness, and you can see that the cat is just dragging that leg. This cat had a brachial plexus avulsion. So obviously the gait evaluation is going to give us clues about, let's do a neurological examination because this is clearly neurological, or I suspect of something a little bit more obscure, like a neoplasia. So hopefully, having in mind all these little changes, crepitus, joint effusion, inflammation, pain, etc., we can localize where the problem is, and together with the signalment, the history, the progression of the lameness, the severity of the lameness, we can create a differential diagnosis, a list of the most likely conditions, and we can actually create a list. And some of the conditions will be at the top of the list, and some of them will be lower in the list. So that will help us decide which diagnostics to perform. If we found that there are changes in the elbow, generally we will do a CT, which is more sensitive than radiographs, or if the dog is painful in the supraspinatus, we can do an ultrasound. So our findings are going to guide us on which diagnostic to perform. Or, for example, if we see joint effusion in several joints, for example, we will do arthrocentesis because that dog may have polyarthritis. In some cases, we will do, depending on this differential diagnosis or the age of the patient, we will do some blood work and urinalysis. In some cases, we will add serology and other tests like regional blockades or intra-articular blockades, or biopsies or taking samples or other tests, so that hopefully we can reach a diagnosis, which is not always the case, but sometimes we just need to wait and see how the animal progresses or how the animal responds to some type of treatment, depending on the suspicions that we have. But it's very important to have a very good communication with the client so that they understand the pros and cons of the different management options, and then also monitor how that animal progresses. So just to finish, sorry, I think I'm over the time. Take-home messages is just try to get as much information as possible from the animal, previous history, signalment, etc. Very important to do a careful gait evaluation to know where the problem, where the lameness is, and then a complete orthopedic examination is key, is critical to localize where the problem is in that limb that is lame. We need to evaluate not only pain, but also muscle mass, tone, temperature, joint effusion, crepitus, all that range of motion. All that is going to give us clues where the problem might be, even if the animal doesn't tell us by showing pain. And then in some occasions, we perform a neurological examination if we suspect that actually the problem of the dog is neurological more than orthopedic or musculoskeletal. So with that, thank you very much. Sorry, guys, it was a little bit longer, but I hope it helps you, and I hope you can take some tips about how to take advantage of performing the orthopedic examination. And I wanted to actually mention the importance that doing a complete orthopedic examination has in trying to reach a diagnosis. So thank you very much for coming.
Yeah, fantastic, Pilar. Thank you so much. Some great videos there, actually. It's really useful to see the sort of videos as you're explaining it. Really, really helpful. If anybody's got any questions, then please pop them in the Q&A. I mean, I've got a couple of questions. I've got quite a few questions, but so I can start. But you mentioned in the last slide actually about assessing other things other than pain, so maybe swelling or crepitus or range of motion. I think it's quite difficult to sort of know how much weight or weighting to put on different factors when an orthopedic exam. If you've got any guidance there, maybe other than pain, which ones to look out for and how much sort of influence to put on them?
That's a very good question. And I think all of them are important. In some cases, we may see crepitus. In other cases, we don't feel that much crepitus, but we feel decreased range of motion. So that means that there's something wrong in that joint. So it doesn't necessarily need to be crepitus and decreased range of motion, for example. So all of them may show at the same time, or an animal may have crepitus, decreased range of motion, pain, swelling, all of them. But some animals may just show one or two, but that's enough to say, okay, especially if we don't see anything else very obvious, just to say, okay, this is not normal. It means that there's something in there. It may not be that clinically significant, but if we don't find anything else, maybe then it's significant and it's enough to cause the lameness. So I think all of them, we need to put them in the equation. And as I said, we need to get as much information, because even just a little bit of joint effusion could be enough to say, okay, there's a problem in that elbow, let's do a CT, and then we can see changes. Not all animal, there are dogs, for example, with elbow dysplasia that have really good range of motion. It's always really difficult, and I find it difficult sometimes myself, because when you flex and extend the elbow, obviously, how much flexion do you do? Obviously, if you do a lot of flexion, you can make even a healthy dog a little bit uncomfortable. So you need to find how much flexion or how much tension you need to put for an animal to show discomfort. But sometimes it can be challenging. I have some colleagues that actually do a lot of flexion and flex it, and obviously an animal is gonna react, but is that real or not? So you need to find your own way of doing your orthopedic examination and know the reaction of a normal animal and an animal that is painful.
I
But
think
all
that's
of
the
them are
key.
important.
That's the key. Plenty of orthopedic examinations on
Yeah,
what is normal and what is not normal is really key, actually.
practice.
Yeah, practice, I think. Okay. There's nothing, but if any of the guys that are on now have any questions, but another area that has always bugged me and is when you get a dog that's obviously lame, and when you examine it, it's either stoic or it's tough or its adrenaline is up or something like that, and you just cannot find the lameness. Have you got any tips with these sort of stoic dogs? You talked about colleagues maybe over flexing and sort of, being more physical, but is there any strategies there?
I mean, sometimes, as I said, we can walk them in circle. So generally, the limb that is in the inner part of the circle will show. I mean, let's see if I can explain it correctly. If a limb is painful and the animal will show lameness, it will be more obvious when we do a circle, when we make them walk in a circle, when that limb is in the inner part of the circle. So we can exacerbate or make the lameness more obvious than when they walk in a straight line. So that's for the gait analysis. If we are not sure if a dog is lame or not, and we cannot see a lameness, we can make them walk in a circle. About the orthopedic examination, I mean, it happens. Sometimes the animal is very stoic and doesn't show anything. And then we need to go with the changes that don't depend on the animal reacting. So joint effusion, crepitus, any changes, any swelling, any decreased range of motion, they don't depend on the reaction of the animal. But even subtle changes, and that's very variable. And sometimes I find myself asking the client, would they complain if they were painful? And then they can tell you a little bit, yeah, he will complain, or no, it's very stoic. So you need to look for those clues of licking the lips or changing in panting. But sometimes it can be very very difficult. And sometimes I find myself just going with, okay, I found a little bit of effusion or a little bit of, I think I find some crepitus, let's do some imaging. Or sometimes I do imaging of the whole forelimb and see what I find. But it can be really useful. But generally, I only do this when the animal doesn't show which one. For example, if I do CT of the whole forelimb because the animal doesn't show pain, I do CT of the whole forelimb and I see changes in the shoulder and the elbow. And I may see a little bit of crepitus or joint effusion or something like that. But actually, the most important part will be which one is the one that is causing pain and then lameness. And that's where the animal may not help. In those cases, I may use a local blockade. So I inject a local anesthetic, for example, I choose. If I see changes in the shoulder and the elbow and the animal is not telling me which one hurts more, then I block the elbow, for example, and then I do gait evaluation again. And if lameness improves, then it's likely that it's because the elbow, not because of the shoulder, because I blocked the elbow.
Yeah.
That's something that one can consider doing it, but sometimes cases can be a little bit challenging. That's true.
Yeah, they can. Okay. Well, I've got one more as well, actually. So when I was practicing COVID, obviously everything was remote. So when we're trying to assess orthopedic conditions, we used video a lot. And I think owners are more and more embracing they've got mobile phones, they've got everything else. So when I was in practice, you used to get a whole variety of videos ranging from dogs running up and down hills to, just a dog running through the woods where you couldn't really evaluate it. Have you got any tips for practitioners to give owners about the best way to take a video of a dog so we can sort of see them in their natural environment, but equally in a controlled way? Have you got any tips there?
Yeah, I would say because I received many videos and through the platform as well, and sometimes the animal is jumping and then it's like 3 seconds of a video where you
Yeah,
can hardly see anything. So the videos that are more helpful are the ones that I show here. If we can have an animal walking towards us and away from us in a straight line or as much as possible, that would be great. I understand that sometimes the owner or the client is the one recording and is next to the dog, but I would say at walk and at trot. If they are galloping, if they are running, it might be more difficult to see some types of lamenesses. So I would say, in a controlled manner with the lead, at walk is very, very helpful in a straight line. So, and in a way that we can see the forelimbs, so coming towards us and then going away from us so we can evaluate the hind limbs. And from the side can also be very helpful, especially to see the range of motion of the hip, especially and the reaching of the forelimbs. So I would say that those will be the most useful videos that they can send us.
yeah,
But I understand that sometimes it can be challenging for the clients.
yeah, yeah, absolutely. Okay, fantastic. Well, it's 8 o'clock here, so thank you very much, Pilar. Brilliant as always. Loads of tips there, and I'm sure people use that as a reference to go back. We can always put that together with the other orthopedic talk that you've done as well, which actually dovetails really nicely. So do have a look on the website for Pilar's last one as well. We've got many more webinars coming up over the next few months and weeks and months. So if you want to register on the webinar, please click there. If you want to have a look at our specialist advice service, have a look on the website or do contact me directly. I'd be more than happy to chat things through as well. But other than that, thank you very much.